Hello and welcome to Wisconsin Doctors. I'm your host, Jessa Jeremiah. We're filming today in Dodgeville, Wisconsin at Upland Hills Health. We're going to be hearing from the orthopedic surgery department in a little while in the program. We're joined today by Dr. James Self and Melissa Messer, who's a physician assistant. We're talking a little bit about winter injuries and some ways you can avoid them if you are injured, when it's time to seek care, and what recovery looks like. We're also going to be joined by Stuart Mitchell, physical therapist, to learn more about recovery time here at Upland Hills Health. It's all in Wisconsin Doctors, and it's all coming up next. Welcome back to Wisconsin Doctors. I'm Jessa Jeremiah, and as promised, we are here at Upland Hills Health in Dodgeville, Wisconsin, talking about orthopedic surgery department. Today I'm joined by Dr. James Self and Melissa Messer, physician assistant. Thank you for joining me today.
Thanks for having us.
We have a lot to cover on today's program. We're going to get in a little bit later in the show about some of the injuries and things that we're seeing in the winter months. Talk a lot about what you two do in the surgery department. First, let's get a broad overview of orthopedic surgery in general, if you would.
Orthopedics covers mainly bones and joints, different types of injuries from fractures to sports injuries, tendons, ligaments. We deal mainly with shoulders, elbows, wrists, hips, knees, ankles, but it's just a general practice of the musculoskeletal system.
And Dr. Self, I want to introduce you to viewers at home that are watching. Talk to us a little bit about your background in the field.
I've been an orthopedic surgeon probably about 30 years now. I trained initially in Texas and then I did a fellowship at the Mayo Clinic in Rochester, Minnesota. Prior to coming out to Upland Hills Health, I worked in Madison for several years, and we've been out here for some time now.
Well, congratulations, and thanks for many years of great work. Melissa, you have an extensive background yourself. Share that with us.
Yeah, well, I'm a local girl, so I grew up in the area, and I've been a physician assistant 12 years now. I started out my career actually in a different specialty. It was urology, but the excellent thing about being a physician assistant is that we can change our specialties. So about 8 years ago, I joined Dr. Self and began orthopedic surgery out here in Dodgeville. I went to school at Midwestern University in the Chicagoland area. And a physician assistant is typically a master's program. So I began my career at UW-Platteville getting a degree in biology, and then eventually through experience and then school, I have a master's degree in physician assistant studies.
Quite the backgrounds, the two of you. And now here you are together, and let's talk about what the team looks like for potential patients and viewers that are interested in learning a little bit about how you work together.
So typically, when a patient comes to see us, when they're a brand new patient, they start out with a visit with Dr. Self, where there's x-rays involved most likely. All of the services can be found here at the hospital, whether it's the surgery, therapy, x-rays, and the office visit. Dr. Self and I take care of patients together, so once they've had their surgery or they're coming back for follow-up, then they usually see my face. But we've been practicing here since 2010 in Dodgeville.
Wow, congratulations on that. We have a lot more to cover. We're going to talk about more specific types of surgeries, and we're also going to talk a little bit about what happens in the winter months that could increase slips, falls, and some of the work that you do. So we'll do that after the break. Thank you so much to Melissa and Dr. Self. We're here at Upland Hills Health in Dodgeville, and we'll be back with more Wisconsin Doctors after this. Hello and welcome back to Wisconsin Doctors. If you're just tuning in, we're here at Upland Hills Health in Dodgeville, Wisconsin. We're talking about orthopedic surgery today. We got a little bit of an overview and introduced you to Dr. James Self and Melissa Messer, who is a physician assistant. We appreciate you joining us and thank you for returning. Lots to cover. So this is the time for you viewers out there where we get to talk a little bit about activities that could lead to pain. You might hear some of these and think about yourself. So let's discuss some of the activities that often lead to specifically shoulder pain, a common one for folks.
Sure, there are many ways to injure a shoulder. A lot of different situations. People can get hurt at work, they can get hurt at home, out in the yard, as well as just doing their hobbies or leisure activities. There's kind of some main categories of ways of injuring your shoulder: by working overhead, by jerking or jarring motions, overusing your shoulder, as well as falling. So examples of overhead activities at work: sometimes people have to get boxes up onto high shelves, they're stacking heavy things, they're lifting heavy objects. At home in the summertime, it's yard work, it's pulling on your motors, starting things, a stuck weed that you yank really hard on. In your summertime fun things, water skiing, playing on a basketball court, anything that has that chance of falling or landing or reaching in a strange direction, as well as just overuse activities that for the most part wouldn't hurt you, but if you do them over and over again, they can just continue to add on to the inflammation and soreness, which can then sometimes lead to new pain or an injury. Falls are also a big culprit. Falls can tear tendons, strain tendons, as well as break bones. Some people can fall directly onto a shoulder to hurt it, as well as falling out onto their arms. Most people's natural instinct when they fall is to grab something. That grabbing and falling is essentially the same as yanking your arm out. So that can hurt a rotator cuff, it can hurt other tendons, and it on occasion cause fractures.
So interesting how we make these decisions in the moment that can have such a big, unfortunately, negative impact on our bodies, specifically in the winter months, because there are some added challenges. So you know firsthand what some of the additional visits might be from. Let's talk about the activities that are really towards the winter months.
Here in Wisconsin, we all know we have snow. We get it, it piles high, it's heavy, it's dense snow. Most people have to shovel their driveway, have to shovel their sidewalks. Everyone has to get to work. You want to get it done fast. You take really big scoops and try to shovel that snow. Well, those heavy loads can put a lot of strain on the shoulder. Clearing snow, it's good to use small scoops and push that snow out of the way. Don't try to lift it. Scraping your car windows, that's a lot of reaching your arm out, getting your arm away, jarring, jerking type motions. The ice is very slippery, so just the same as slipping in the summer, slipping in the winter can be just as bad. Essentially, when you slip, you can land anywhere, breaking any bone. Shoulders really can get hurt with those falls. Most people tend to brace themselves and land down on their arms. So in wintertime, it's a good idea to wear the proper shoes for being outdoors, wear boots, wear something that grips. And then also kind of the jerking, jarring motions, starting your snowblower, pulling on something, as well as just overuse. Just continue to use the arm for an activity even though you're sore. And then Christmas time also brings us something different. People getting up on ladders, whether it's putting the tree topper on and falling, putting up your lights. So being safe with those activities, safely getting up to your roof or asking for help, using safety measures to prevent falls.
We've all been there with some of the things that you just mentioned. Unfortunately, prevention is a great thing, but we don't always think about preventing the injury beforehand. So if you're somebody that's been in this situation, you have pain due to an activity, how do you know, Dr. Self, if someone's in your office for pain, if it's something that just needs rest, or is it time for surgery?
Well, frequently with just minor strains and sprains, we always recommend trying the standard things first, like ice and rest and anti-inflammatories. A lot of people can get a sore joint or shoulder just by doing some activities, but it may calm down within a few days. But if the pain persists, then that's typically when they make an appointment to come in for an evaluation. We tend to get x-rays just as a baseline to know where people are with things. The x-rays mainly tell us about arthritis and not necessarily about the soft tissues or tendons, but we start there. We try conservative things like physical therapy and injections first, and then if we're not getting improvement, then we go for further studies such as an MRI.
So as a patient or a potential patient, One of the things that we like to know, of course, is how many surgeries have you performed as a doctor? And we've talked a lot about your history in the beginning segment. How many surgeries do you have under your belt as a team?
Probably since we've been in Dodgeville, at least a couple of thousand surgeries. We do usually around 200 to 250 a year, but over my career, it's many, many more than that.
Lots of people taking too big of scoops with the shovel, it sounds like. I also want to talk about, the specific surgeries that are often needed. What are the most common surgeries that you're performing out of that number you just mentioned?
Well, when we're just talking about the shoulder, even with just the shoulder, there's many types of procedures we do. Sometimes it's just minor things to relieve some symptoms related to chronic inflammation or arthritis. But other times it does involve things like rotator cuff repairs, which is a much more involved surgery and a much longer recovery. So there's a very broad spectrum of things that we can do, things that might need to be worked on in the shoulder, and that affects recovery from being a matter of just a few weeks to several months.
So perfect segue for our next topic. After the break, we're going to talk about a little bit more about prevention and then, of course, about recovery. So Melissa, Dr. Self, thanks so much. We'll see you after the break, and we hope to see you after the break. We're Wisconsin Doctors, and we'll be right back. Hi, welcome back to Wisconsin Doctors. I'm Jessa Jeremiah here at Upland Hills Health in Dodgeville, Wisconsin. We've learned a lot today about orthopedic surgery, and Dr. James Self and Melissa Messer, physician assistant, are back again to talk to us a little bit more about the surgery process here at Upland Hills Health. Thanks for returning.
Thank you.
Now, we've talked a lot about some of the activities that can lead to injury, whether or not those activities require rest or require surgery. So let's talk about, when we are ready to move on to the surgery conversation, why choose orthopedic surgery at Upland Hills Health?
Well, we like to feel that we provide state-of-the-art treatment for shoulder problems. We do most of the procedures through the scope, and we feel that we stay up to date with the modern equipment, and that will be improving even more in 2020 when we open our new surgery facilities here at the hospital.
And talking about surgical equipment in general, let's compare that here. So you mentioned some upgrades are coming, already state-of-the-art equipment here at Upland Hills Health. How do you think that compares to other hospitals in the area?
I think you can get similar procedures here as you can in Madison. We do most of our things through the scope, or what's called arthroscopy. In Madison, some of the providers still do open procedures, which tend to be a little more recovery and more painful. Now, arthroscopic procedures are definitely available in Madison, but I think we provide a similar quality of care here in Dodgeville.
I'm glad you mentioned that, because oftentimes viewers do have the misconception that a surgery procedure might be better in Madison, and that's not so. In fact, it could be the same or better here at Upland Hills Health, so that's nice to know. I would like to talk about recovery and pain management in this segment, so let's discuss some of the things that you do here.
Shoulder surgeries, rotator cuff injuries, and repairs are known to be a painful procedure. Most times you'll hear from a friend, oh, that was the most painful thing I ever went through. So here at Upland Hills Health, we have an excellent anesthesia team who've had extra training. They do ultrasound-guided techniques to help with pain control. So we start controlling the pain the moment they hit the recovery room. There are ways of dealing with pain that don't use narcotics. Narcotics do have a reason to be out there, but we want to reduce that amount of use as possible, and as well as keeping the patient comfortable. So after the surgery, they're taught how to control their pain, when to appropriately take their medicines as they're leaving the hospital. And then within a week later, they come back and see us. And so at that visit, we really get a chance to look at the patient, see how they're recuperating, reiterate what we did in their surgery, what they can and can't do after surgery. In fact, the surgery is almost the easiest part. The hardest part is then recuperating at a proper pace, getting back to your activities at the right speed. We do these surgeries to keep people active. We want to get them back to work. We want to get them back to their activities or playing with their grandkids. So we actually begin exercises right away. We have athletic trainers that work with us in our office, so they'll do the initial teaching of exercises. That allows the patient to start those on their own and get going. Currently we have therapy at 4 locations with a soon-to-be 5th location opening at Upland Hills Health. So then we'll get the patient established with a physical therapist or physical therapy assistant to continue their recuperation, gaining strength, but at the right speed. So they'll get advice along the way on what they can and can't do so that they can heal properly.
There's a lot to know. Glad to have the experts on our side today for our conversation. We've covered most of orthopedics today, at least in the broad sense. What we haven't covered yet is physical therapy. So that's a big part of the process, as you mentioned, that recovery phase. We're going to talk about that more after the break here on Wisconsin Doctors, so please stay with us. Hello and welcome back to Wisconsin Doctors. I'm Jessa Jeremiah, filming here today at Upland Hills Health in Dodgeville, Wisconsin. If you're just tuning in, we've had quite the program so far. Dr. Self and Melissa Messer, physician assistant with orthopedic surgery, have been here today talking to us about what might lead a person to surgery and what the surgery process looks like here at Upland Hills Health. There's more to cover. We're going to talk more about physical therapy after surgery and also some of the activities that might lead you to need it. I'm joined now by Stuart Mitchell, physical therapist here. Thanks for being here today.
Pleasure to be here.
So we're going to cover a little bit more about some of those activities that could happen in the winter months. We talked a lot about shoveling that can lead to shoulder pain, but it could lead to other things too. And I want you to share with viewers what other pains they might be experiencing and what that could mean for them.
Yeah. So shoveling is a pretty active winter activity, especially with people who might not be that active throughout their daily life. So yes, shoulder pain can be something that can be happening when you're doing a lot of shoveling or throwing or tossing that snow, but a big thing that we also want to be wary of is, not aggravating your back. So low back pain is a really common thing with shoveling, as well as the fact that if you are doing something that you haven't been active for a long time and then doing a pretty aerobic activity, heart attacks are also a very common thing with shoveling. So want to make sure that you're wary that if that shoulder pain that starts to go down the arm or even a tightness in your chest, you might want to get that checked out because there's something maybe very serious wrong.
Yeah, so don't brush it off. It's always better to be safe than sorry. As you mentioned, there could be something more concerning happening. So outside of those, sort of strenuous winter activities, one of the things we often forget about is posture. So how can posture play a role in shoulder pain?
The shoulder is such a complex joint, so the more that you actually are standing or sitting correctly and then using your arms, it really adds everything, sort of comes together really nicely. When we're slumped and we have that forward head, not only is it putting stress on the neck, but it also doesn't allow that shoulder complex to move very well. And so with repetitive injuries, with poor posture, it can really add, and a little bit can add to a bigger problem down the line.
Absolutely. So in your line of work, you know just how tedious and sometimes extensive recovery can be. So what would you like to say to people about prevention of shoulder pain?
Yeah, the phrase, ounce of prevention is worth a pound of cure. So the more that you can work on that posture, more that you can actually work with proper body mechanics from anything from the low back pain with shoveling or even lifting, but even overhead, just not allowing yourself to get sloppy. And usually when we get tired or in a rush, now we're starting to break down in the way that we don't want to break down. And that's when injuries occur. So we forgot your advice and we have an injury. Now what do we do?
Let's talk a little bit about if something does happen, maybe it's a freak accident or something just isn't feeling quite right. What can we do to feel better and rest?
Right. Well, injuries are always going to happen, right? We can't prevent injuries, but the more that you can rest it, try not to aggravate it anymore. So sometimes a small little injury can become a bigger one just because we're ignoring it. We want to just finish that task. We just don't want to take a break. So the more that you can, be conscious about, all right, I want that good posture, great mechanics, but also just listening to your body. Things do start to get sore, as Melissa said earlier, or Dr. Self said earlier, doing the ice, the anti-inflammatories if appropriate, but just allowing your body to heal.
Okay, so there's some things you can do obviously at home. If you are in a position where surgery is needed, and we talked about that process earlier in the program, the recovery is really where you come in and where your expertise lies. So let's talk about surgery recovery. What does that look like? What kind of exercises are you doing? What's the process?
Well, it all depends on the surgery. There's always going to be lots of questions, and that's kind of a big part of what we're doing. Is we're sort of that bridge to, what the doctor expects, what the body needs to do, and how we can get that person back to doing their normal activities quick again. So usually there's a protocol that's associated with the surgery, and that protocol is established just because we can't speed up the body actually healing itself. We can slow it down, and we don't want to slow it down. So we just want to maximize what our bodies can do. So slow movements, trying to get the shoulder blades involved so that the shoulder joint doesn't have to do all the work, and just adding strength when it's appropriate so that we can, get that shoulder back.
And Melissa and Dr. Self talked about this earlier, but sometimes surgery is the easy part, or certainly the more speedy part.
Yeah.
Recovery can be lengthy. So what would somebody be looking at in terms of length of recovery? How many times a day or week are you looking at for somebody?
So all depends on the surgery itself again, or the injury. Usually we're seeing people twice a week in physical therapy. It could be more, could be a little bit less, depending on what is needed. And then it's just a matter of coming in. We do some things with therapy. Usually we establish a good home exercise program for them to do that every day. And then we come back, we check that, make sure that everything's going good, and progressing as needed.
Excellent. So beyond being here in the physical therapy department, you also have the opportunity to provide some homework for people as well.
Correct. Yeah.
Okay.
Homework's
so
very
there's homework
important.
involved. Well, this has been enlightening. What a great conversation we've had today about orthopedics, physical therapy. Stuart Mitchell, thank you for being with us today, and thank you for your time.
Thank you. Appreciate it.
I want to thank you for watching Wisconsin Doctors, and thanks to our guests, Dr. Self and Melissa Messer. I'm Jessa Jeremiah, reminding you to live longer and live better. We'll see you next time.